Let's take you live to Queen's Park, where Ontario's Ombudsman is releasing his latest report on the long-term care ministry's oversight of homes during the COVID-19 pandemic.
That's not just the title of my report. It's the key reason for investigating long-term care and my resulting recommendations. Je suis ici aujourd'hui pour parler des leçons sur le long terme. Il ne s'agit pas que du titre de mon rapport, c'est aussi la principale raison de mon enquête sur les soins de longue durée et mes recommandations qui en découlent. More than 4,000 long-term care residents and 13 staff members died from COVID during the first 2 years of the pandemic, almost 2,000 of them in the first few months. Long-term care residents account for 1/3 of Ontario's death toll during COVID. Now, that's a disproportionate impact on a vulnerable segment of our society. I'm aware that there have been other reviews and reports about the devastating effects of COVID-19 on long-term care in this province. However, our investigation did not duplicate the work of other reviews. Rather, we focused on the Ministry of Long-Term Care's inspections branch, and we uncovered evidence that was not previously revealed about how this important oversight function collapsed when COVID hit. I have made 76 recommendations, all aimed at ensuring that this province is better prepared to protect long-term care residents and staff when the next health emergency arrives. I'm pleased to report that all of my recommendations have been accepted, and the ministry has pledged to report back to me on a regular basis on its progress in implementing them. J'ai fait 66 recommandations visant toutes à mieux préparer la province à protéger les résidents et résidentes et le personnel des foyers de soins de longue durée lors de la prochaine urgence de santé. Je suis content de dire que mes recommandations ont toutes été acceptées et que le ministère s'est engagé à me rendre compte de façon régulière sur le progrès de leur mise en œuvre. Now, this report goes into great detail about the ministry's inspection regime, which even before the pandemic was strained. However, the evidence we gathered reveals that the challenges of COVID completely overwhelmed it. Our investigation identified problems with nearly every aspect of the inspection branch's processes during the first COVID wave. The ministry had no plan or guidelines for how to do inspections during a pandemic, so none were done for 7 weeks, even as reports of outbreaks and health risks to residents and staff inside the homes poured in. Inspectors did not have access to personal protective equipment or training in infection prevention and control. Many were directed to contact long-term care homes by phone and take on more of a supportive role than an investigative one. They relied entirely on self-reporting by the homes. We discovered that extremely serious COVID-related issues, such as infection prevention and control or personal equipment, protective equipment usage, were not inspected in a timely manner or at all. The inspections branch also did little or often nothing when homes did file reports about COVID-19 outbreaks. Even when the inspections resumed and violations of the law were found, the inspections branch often took the least severe enforcement action available, even in serious situations. Homes were given many months to fix significant issues that posed a serious risk of harm to residents, and the action taken was often documented in confusing or poorly written reports. The direct result of the lack of inspections, reports, and enforcement was a lack of protection for residents and staff, and a lack of accountability for the system. Le résultat direct du manque d'inspection, de rapports et d'application de la loi a été un manque de protection des résidents et du personnel, ainsi qu'un manque d'imputabilité de la part du système. So we've included in this report some stories from families of residents who tried in vain to get the ministry to respond to their concerns about the conditions within the homes that their loved ones were living in. Several of these residents died before anything was done. For example, Peter complained 3 times about the lack of COVID infection control and his mother's worsening conditions at the home. And again, after she died, an inspection was not done for 6 months. Rahim complained 3 times about a home's lack of COVID infection control, putting both his parents at risk. His father died and his mother was hospitalized. The ministry ultimately inspected the home, but took more than 2 months to issue an inspection report. We also described some disturbing cases where, based on a review of the inspection reports, homes were not penalized to the extent that they could have been, despite repeated findings of noncompliance. Now, the good news is that in addition to accepting my recommendation, the ministry has already made several improvements. It now has a new policy that provides for training, communications, and PPE across the province in case of a pandemic, and a checklist to follow when it happens. However, there is still work to do. Among other things, it remains to be seen whether inspectors and the ministry will take enforcement action when appropriate. Now, the ministry's goal should always be to confirm that long-term care homes are complying with legislative requirements and to act quickly when they don't. L'objectif du ministère devrait être toujours de vérifier la conformité des foyers de soins de longue durée aux exigences législatives et, dans le négatif, d'agir rapidement. Ensuring the safety of residents and staff must be the primary mission of the branch and reflected in its work culture. It's also crucial that the government strengthen the long-term care sector's ability to respond to crisis by ensuring that there are enough inspectors and by revising legislation to expand the circumstances in which homes must report critical incidents. Homes should not be relieved of their responsibility to properly document resident care, even in emergencies. COVID-19 has not gone away, and it will not be Ontario's last pandemic. I'm hopeful that if my recommendations are implemented and the province remains committed to remembering the lessons from this experience, it will be ready when the next threat arrives. Long-term care staff, residents, their loved ones, and all Ontarians deserve nothing less. Je répondrai maintenant à vos questions. I'll be happy to take your questions now.
This current government cut back on long-term care inspections when they took office in 2018, I believe. Did you find that led to more issues during the pandemic?
So what we found was that the inspection system was already strained before COVID hit, and it had been that way for a long time. There were some homes that were in non-compliance. And so at the core of this investigation is inspections, because to effectively oversee a system, you have to have inspections. You know, you think of the CRA enforcing the Income Tax Act. They do audits, right? You can't take people's word for how things are being done. And so at the core of the ministry's oversight responsibility is the inspection function. And what we found that it was just not ready for this. It was already strained before the pandemic, but it was not ready. Didn't have a plan, didn't have sufficient people to do those inspections. So
we've cut back on, right?
Well, they've hired more since then. So what we focused on was the situation from June 20th, or well, actually March 20th forward, so the beginning of the inspection, the beginning of the pandemic, rather.
What was the most egregious thing you saw during your investigation?
Well, I think that, you know, we tell the stories of severe cases of outbreaks that were being signaled to the inspections branch, and there was a lack of action, a lack of appropriate action, and people weren't going into the homes for a long period of time. And then when the inspections did resume, some of the homes were let off quite easily. And when you look at the scale of sanctions that could have been imposed, they were often given the least onerous sanctions or given time to fix things rather than really facing tough sanctions.
It was a terrible time, and there was a lot of fear. Yeah. Were inspectors refusing to go in and expose themselves? Like, what was going on, and did the government allow that?
So yes, some inspectors did refuse to go in, and the union took a stance to try and protect its members, and that's their role. The problem, though, was not the refusal or the actions of the inspectors union. The problem was that the system wasn't there to enable inspections to happen in a safe and effective manner. That's what we're talking about, and that's what we address in the recommendations, is being prepared the next time. So having enough inspectors to go around, having inspectors with training in infection and control, having inspectors that are trained in the use of PPE, and so that they have those protections. You know, they're entitled to a safe workplace too.
So we saw the horrifying stories, and we've heard the horrifying stories of when Canada had to send in, the government had to send in forces. Yeah. Could that have been avoided if there were proper inspections earlier on?
Well, that's speculation. I can't speculate on that. But what I would hope is going forward that wouldn't have to happen in the future, that if we had a proper inspection regime, you had enough inspectors who were properly trained, that had the PPE, that work with public health units in partnership, those kind of things would not be necessary in the future. That's the hope.
So the alarm bells weren't ringing soon enough because there were no inspectors to send out.
A lot of things were being missed, and we highlight in the report, and I've cited some of those examples. Loved ones were, as you say, it was a terrible time, and a lot of things were being notified to the inspections branch, and what we found was that either they were unable to act or they didn't have a plan to act in a timely manner.
Did you find a difference between the for-profit homes versus the not-for-profit?
We didn't look at that, and what we focused on is inspections, and the inspection regime should be the same for profit or non-profit homes, and so there was that was not a focus of our investigation.
Were they the same between profit and non-profit homes when it came to how the inspectors responded?
As far as I know, yes. As far as I know, the breakdown of the system, the lack of inspections was across the board, and the problems that we signaled were across the board.
Mr. Dubé, do you think if there had been more inspections that some of the tragedies could have been avoided?
Again, speculation, but you have to wonder, right? Like there were no inspections for 7 weeks. During those 7 weeks, 720 people died in homes. I'm sure that they can't all be attributed to COVID, but you'd like to think that with adequate inspections, with rigorous inspections, with rigorous enforcement of the regulations, that safety would be optimized for residents and staff.
I was curious too about the lack of knowledge just from senior government officials about what was going on. You said this was, in a report you talk about it being limited to pretty much the inspection branch was the only branch of government that seemed to know that this had been paused. So what did the political side know about what was happening in the long-term care homes? Well,
the political side is not the focus of our investigation. We look at administrative issues. We look at sound administration and fairness, and so that was the focus, right? Is what the bureaucracy, how the bureaucracy responded, how the bureaucracy was prepared, how the inspections branch. Basically, it's the oversight of the ministry of the inspections function. And I'll say it again, you can't have effective oversight and enforce compliance with regulations if you don't do adequate inspections. And that's what we saw break down during COVID.
I think you also said, though, some senior government officials on the bureaucracy side didn't even know that this was going on.
Yeah, so one of the things we call for, and it's in the recommendations, right, that there be more oversight of file management, that managers be more involved, that there are more eyes on these reports, and more people involved in decisions on what the sanctions should be to maximize enforcement.
How did they not know?
Well, there's ways that files were handled and things were kept in isolation at times, I'm sure. So that's what we're calling for, is more transparency, more accountability, and more people involved in the review internally of those files so that the decisions are not made in isolation. And I think that's just sound governance and sound practice.
With winter on the horizon, flu season, expected increase in COVID cases, what recommendations would you like the ministry to address sooner rather than later that they haven't already?
Well, the report is being released today. We don't have the 6-month report back yet. We hear that they're hiring more, that they have hired more inspectors. There's a new law, new rules, but it remains to be seen with what vigor the inspections are carried out and what kind of enforcement is imposed when shortcomings are found. So it's my hope, and that's why we were anxious to get this report out and get these recommendations and being acted upon, because you're right, winter is coming, COVID is still around, and it's a concern.
We have heard we have heard others detail this real breakdown in inspections, whether it's during the first wave of COVID or continuing today. Like, isn't this stuff that the government should have acted on a long time ago? The COVID has been going on. I mean, it started, this is more than 3 years later.
Well, and we had SARS, right? And there were lessons to be learned from SARS. And I think this is what we focused on when we chose the title for this report. Let's take this opportunity to learn some lessons, right? Let's improve situation. Let's improve preparation so that the next time a pandemic hits, that the province is more prepared in long-term care to handle it, to keep residents safe, to keep staff safe, and to keep death and illness to a minimum.
Your report talks about dehydration and neglect and malnutrition at times. Did you ever find proof that this happened in any of the homes, residents dying not necessarily because of COVID? But
So I don't have oversight of long-term care, right? I have oversight of the ministry. So the patient ombudsman looked into the patient experience, or the resident experience, if you will. So that was not within the purview of our review. So what we focused on was how well the ministry, through its inspections, was overseeing long-term care, and were they doing enough to protect the health and safety of residents and staff. And so the answer was no. The conclusion that we came to was no. And for the reasons I cited, that there was no plan to conduct inspections when a pandemic hit. Inspectors stopped inspecting for long periods of time. They feared for their own safety, understandably. There was a lack of PPE available to them. They didn't have the training in infection prevention and control. And there was a discord, and one of the things we recommend is there should be more collaboration with public health. And then when inspections were done, some of the homes that had violations were not very seriously or very sanctioned very severely in the way they could have. So I think that all of those things will improve the system, will improve the inspections regime, will improve the oversight of the ministry, and we're hopeful that that would lead to better, more health and safety, better outcomes in the
There
future.
was a ministry inspection specifically called when the Canadian Armed Forces, parts of the reports outlining dehydration and neglect deaths at 2 homes in particular, and then the ministry then went and conducted an investigation into those and those reports from the Canadian Armed Forces. This happened way after the first wave. I was wondering if your report, I don't see it in here, but did you look at that inspection that they did?
Well, we looked at all the files that we could during that period of time. I have to say that the Canadian Armed Forces didn't really issue a report, right? They sent a letter.
Internal report.
An internal letter, and one of the things we found was that they did not communicate to the ministry in an effective way all of their findings, right, that is required under the legislation. So the Canadian Armed Forces weren't really briefed. And, but we did look at that, and we reviewed that. That was actually the impetus for launching this investigation when we read those accounts. Some of those accounts have been sort of retracted to a degree. They were based on opinion and not necessarily evidence. So, but it was an important catalyst for us to launch this investigation, definitely.
On something entirely different.
Okay, we've been listening to Ontario's Ombudsman Paul Dubé provide his report on long-term care homes during the 7 weeks, the beginning of the pandemic. 2,000 long-term care residents died during that time, accounting for 1/3 of Ontario's death toll. His report really focused on the inspections branch and whether or not there was proper oversight. They interviewed families and said that the system basically collapsed. A lack of training, lack of inspectors, lack of PE, and also a lack of enforcement and therefore accountability. So he's made those recommendations, and the long-term care ministry has accepted them.